to ask for prayer for my son. And this was back in 2011, before we had all of this. Nobody talked about it. And I remember people just turning their heads and staring at me like I was some lunatic. And it was it was scary. It really was. So, but I decided I wasn't going to be afraid because God is ultimately, He's in charge of everything. So I knew that my son needed the prayers, and I asked, but we need to stop the stigma so that people will get the help that they need. So that's one of the things that was important to me. And then the other thing is the family unit. It's not just the disease of that individual, ever. I work with a lot of inmates. That's really where my heart is at this point. So instead of them sitting in jail, and actually Eastern Regional Jail and has a wonderful medical director, and she's doing wonderful things there. Very grateful for that. She's getting them medicine, she's getting them Medicaid, she's doing a lot of stuff. So they're getting some help now, but they're not getting the help that they need. So they're sitting in there and they're learning worse behaviors and adding to the trauma that they already have. There's something called an ACE score, Adverse Childhood Experiences. And what that means, there's 10 questions on it. And basically, I'll go through a couple of them. Were your parents separated or divorced? My son, yes, he was. Did one of your parents use drugs or alcohol? My son, yes. So were you ever sexually abused? Were you beaten? Did you ever feel like nobody in your family loved you or cared enough about you to take you to the doctor or get you help if you were sick? There's 10 questions. If you answer one, yes, your risk for mental health, addiction, and criminal recidivism, you're already at risk. The more you answer, the higher your risk. So, I just had a guy, I did one on the other day, his was a 10. And the stories that I hear sometimes, I used to cry a lot, and after you get used to doing this for 10 years, you kind of, sadly, you become more adjusted to hearing the stories. You're actually expecting to hear the stories. Not everybody's story is like that. Some people had perfect childhoods. My son had a perfect childhood until the divorce. So the family thing, just like when my son went to treatment and he came home, I thought he was healed because I didn't understand it. So I didn't go get help for myself until he relapsed. When he relapsed, I was in a counselor twice a week, every week, and I couldn't wait to go to that counseling session. And I did that for 3 years. I had been on antidepressants myself for 30 years. And there's something called neurofeedback that actually can rewire the brain back to a healthy state. And it's non-invasive. They're doing it at Renova Center in Carneysville, and I think in New Horizons in Shepherdstown. But it takes a long time, but it does rewire the brain back to a healthy state for depression, anxiety, addiction, and all of those things. And Pastor Huffy, I wanted to say to you that I too, because I have multiple pain issues, went to a doctor who also, I didn't take pain medications. They gave them to me, but I didn't take them. But because I have a Barrett's esophagus, I couldn't swallow pills. It was damaging me. So he slapped a fentanyl patch on me. And so I was in La La Land, literally did not know what I was doing. So for under 3 weeks, I wore that, and I was very sick, and I asked my husband, take me to the ER, please. And they said, absolutely, it is this, it is causing this for you. I too said, rip it off, throw it away. I already knew about addiction, but I didn't know enough about it. I lost 20 pounds in 2 weeks, and I did it on my own also. So the doctors, they are still pushing it. They are, and then the other side of that too is that that they're cutting people off too quickly. They're not giving them, a wing. They're not winging them down, so they're going to go to the street and get them. So that's something too. But as far as it being a family disease, my son came back from treatment. I hand him my debit card and say, "Can you go to the store for me? Here's the PIN." I did not know because I didn't get the help I needed. So it's so very important that the whole family unit, and siblings, my daughters probably still need help. Everybody needs to get help. The whole family unit can heal. So, as far as the incarcerated population, which I said is, that's what I work on most of the time. I work on a lot of pretrial diversions with attorneys, and I was working. I'm currently volunteering my time. I usually take calls 7 days a week, and a lot of inmate calls, and they're desperate to get out. But not only are they desperate to get out, they actually want help. They don't want to keep going through revolving doors. They actually want to get to a point that they can be normal. So I have been able to accumulate and build a lot of relationships, just as Stephanie has, by working with these individuals. And so that's what I'll talk about next is resources, or did you already do that? You didn't talk? Okay. So